My name is Madi Partovi.
And I'm Dr. Ryan Partovi.
Welcome to the Partovi Effect, creating the consensus. And what creating the consensus means to me is no matter what we bring to the table, no matter what we talk about, no matter what we talk about with our guests, may we always be present to the unity and the connectedness that inherently exists between us.
That's beautiful.
Thank you.
I
Today,
think, can I speak to what
yeah,
creating the
please.
consensus means to me
Yeah, I'd
since
like
you started
to.
there? Creating the consensus to me means really creating a shared reality because I think we're sort of at this point as humans where we acknowledge that we create our own reality from a individualistic perspective, and yet there is this broad sense that but there is a there out there, right? Like there's stuff that we can touch and see and taste and feel. And so there is some sort of objective reality, but our experience of it individually is different. So creating the consensus to me is a coming together and agreeing upon, okay, well, what's real, what's not, why do we think so, why don't we think so? So it really gets into that realm of really creating a shared reality that we can kind of agree on and say, okay, this is the truth, right? So it's a pursuit of truth, really. So that's what gets me excited about creating the consensus.
Beautiful. Thank you.
Sure.
Uh, we're going to be talking about cancer today.
Mm. A lot of truth to be uncovered there, I would argue.
Absolutely. And because of the 200 stories that have come our way since we started introducing repurposed drugs into our practice and treating cancer with repurposed drugs, I've been privy to so many personal stories.
And this has just, by the way, been in the last 6 months, I
Yeah.
would say, maybe 7 months now. Yeah.
Just the other day, I was speaking to a woman whose brother who was just diagnosed with stage 4 cancer within the last couple of weeks, right? And he is today like on home hospice, and he has a feeding tube. And she told me that he had been going to his doctors for 1 year, telling them that he suspected he has cancer. And the response he got, but your labs look normal. Your labs look normal.
Just so we're clear, when most doctors say labs, they mean CBC, CMP, lipid, TSH, and if they're good, vitamin D. In men, maybe a PSA, which is, as far as they'll go in terms of cancer screening in a man. And if you're a woman, a mammogram.
So a year-long journey, right? Where he suspected this and was trying to tell people that were supposed to help him. And here he is.
Yeah.
And then you have, somebody close to us who also tells me that her brother-in-law, same story, kept telling the doctors that, you know, something is wrong. Oh, you're fine. Your labs are normal. Let's check in another 3 months. Let's check in another 3 months. And then, gets diagnosed with stage 3. Thank God that this story has ended up a little bit different. He sought alternative care, and he's still with us, and he's not on home hospice like this other gentleman. But yeah, it's for me sometimes, like I'll give an example. So COVID days, I used to cry a lot. And then I there's like a calibration internally. And there's still those stories that moved me and had me get or experience a lot of emotion, and I would move through it very quickly. Um, and I'd wake up the next day. Okay, what is it that I can? Uh, what actions can I take? Like, how can I embody still being joyful and present, and go for it? Like, do everything possible to save these lives. And cancer is a little bit different. I'm still calibrating. So I find my process very, I have to move through it. So I need to move my body sometimes.
Sure.
I do a lot of singing, and lately, it's been never ending story.
Yeah,
Just to kind of shift myself because it's a lot mentally to take.
sure.
Yeah, I think about all of um the parents, you know,
Yeah,
the man that has to pick up his kid, his daughter at school. And that's stage 4 right now and is starting to feel the effects on his body.
right.
And the woman who is so absolutely young and beautiful and shows up, you know, as a patient, and she has 4 kids and is about to get married at the end of the month.
Right.
Yeah, and then that mom that had to tuck in her kids, and then all the financial issues that uh, these people deal with, because they've exhausted their savings, and they're dealing with shit oncologists, um, are expecting them to do it their way or the highway. So it's a lot for me. I'm still in the motions a lot.
Sure.
It's a different beast for me. I get sad and then I get really angry. I get really angry at the stupid system, and like I've said before in a newsletter, that this conventional medical system is not broken. It's actually quite a very robust system, that monetizes people over and over and over again. It doesn't put people first. And even well-meaning doctors inside the system just don't know what it is that they're doing. Or they operate from a very, small lens and an algorithm that is so ordinary. And by ordinary, I mean that they're not listening to people. And, so I get all these stories, and of course we're biased, of course the hundreds of people that are coming to us, I am biased, because we're getting all these stories.
Right.
Nobody's listening to us, and that's what you were getting in the very beginning anyway. Um, Many of your patients, have seen 12, 14, up to 16 doctors with no answers. Okay, and so there's this wave of people who are looking to treat their cancer with repurposed drugs. And what I'm talking about is ivermectin. I'm talking about metformin, mebendazole, albendazole, the whole other suite of FLCCC medications that, are on the list.
Including natural medicines,
In
actually,
Yes, which
which,
you have been deploying, since the early years for almost 15 years
yeah,
with your really keen and masterful, integrative, holistic, naturopathic approach.
right.
Plus, the computer assisted medicine on top of that, the bioinformatics platform. So it's a really unique edge, um, when you're treating cancer, because when the moment that a person gets diagnosed with cancer, you know, fundamental health and wellness becomes so important.
Well, I think that fundamental health and wellness is really, really important when it comes to preventing cancer. And I think when it comes to being diagnosed with cancer, it's really important in terms of being able to survive some of the therapeutics. Because a lot of the therapeutics that are offered by conventional medicine they're pretty toxic, frankly. So the philosophy behind them is, well, we're gonna, try to kill the cancer and hopefully you don't die in the process, right? So that's where I think fundamental health and wellness does come into play there. But
So you're talking about the petroleum derivatives, the mustard gas, the chemo, right?
well, yeah, specifically, I think chemo is the most obvious example of this. It's the one most people know about, and it's the sort of strongest long-term side effects. But some immunotherapies also have pretty significant short-term side effects potentially, and you have to keep an eye on that. And cancer drugs in general are going to have some pretty significant side effects, typically. I mean, compared to other drugs, I would say.
Well, yeah. I mean, some of our patients now, after their chemo, they can't even communicate straight with us.
Mhm.
So give me a couple days.
It's typically very difficult for patients to also continue to take a lot of the complementary therapies we use, you know, during a cycle of chemo. A lot of times they'll have to wait, you know,
So it's like a double whammy.
a few days to maybe a week or two even before they can kind of restart their protocol. And so it's sort of between each cycle of chemo, they're doing the protocol because, you know, whether it be nausea, whether it be loss of appetite, you know, whatever it is that they're dealing with, it can be a big issue. But yeah, I mean, that's one of the challenges. And, you know, I would say usually what we're doing, in fact, what I encourage is usually some kind of complementary, you know, integrative approach where we're using conventional medicine, we're using natural medicine, and we're doing it together. The cool thing about using the repurposed drugs, in my view, is, you know, I think that a lot of them probably do work even synergistically, and they can kind of fill the gap. You know, one of the challenges with uh, natural approaches to cancer is that compliance. You know, compliance can be tricky, and not just because of chemo, but just because of all the different moving parts. And sometimes it's the quantity, you know, it's like not everybody can take 60 pills a day or 60 pills twice a day in some cases. It's a lot, you know, and so I would say that, you know, for those patients, sometimes taking the repurposed drugs can give them a little bit of wiggle room so that if they're not as compliant with the rest of the protocol, they can still see benefits. And to me, that's the most exciting part about the repurposed drugs
Yeah.
is that it gives that wiggle room in terms of compliance, and not just compliance with nutraceuticals. I mean, that's the first thing I mentioned, but diet as well. You know, diet can be hard for some people. I mean, and I get that. And you know, to me, diet is fundamental, it's foundational, but I understand that, you know, not everyone is perfect. And in fact, nobody's perfect in terms of their compliance with the diet or with any aspect of the treatment. And so, you know, having things that kind of bridge the gap and make up the difference can make a real can make the whole process a lot easier.
Yeah, the FLCCC has some pretty powerful anecdotal testimonials thus far, you know, about people being on this protocol, this repurposed drugs protocol, and living with their cancer. I mean, people that came back from hospice.
Yeah, well, and that's something that I mean, I've seen in my practice now for, you know, really since I was in residency at least, which is patients that, you know, sort of get healthy and can live with their cancer and keep it in check for 20 plus years, you know, with stage 4 cancer. So there's this impulse, which is, oh, let's get cancer free. I need to get cancer free. We want to get cancer free. And of course, we want to get cancer free. That's true. But depending on the patient's sort of level of compliance, sometimes it's often easier to just basically have no progression of the disease, and maybe it doesn't get any better, but it also doesn't get any worse. So, and sometimes that's great to give them quality of life for as long as they choose to have it, you know.
You know, I just became present too.
Hmm.
Like I talked about these FLCCC stories, right? And in my mind, I'm like, oh my God, these are miracles. And you came back with what you said, and my mind was blown. I'm like, okay. You're present to miracles like all around you, like for the past, you know, however long you've been in practice,
Yeah.
and that's just really extraordinary.
Yeah, I mean, to me, the repurposed drugs, which, you know, I've used, for example, low dose naltrexone in my oncology practice for, oh, I don't know, probably at least a decade. You know, that's something which in naturopathic circles is pretty well known and well appreciated and well um, acknowledged as a potentially anti-neoplastic therapy. But, you know, I think the FLCCC is sort of in many ways beginning the process of mainstreaming some of these things that we've been doing for a long time, while also adding in a few new things. You know, I will say that a lot of the things, and I don't have the list in front of me, but I would say things like curcumin, omega-3 fats, melatonin, green tea extract. These are things which we've used, you know, naturopathically, we've been using for decades before I came around, you know. But I would say that the addition of the repurposed drugs and really bringing additional drugs on into play and allowing us to say, okay, well, this repurposed drug may be particularly useful in these particular types of cancers. That kind of thing, I think, is really, it expands the integrative piece for sure. And a lot of these things being so affordable, being available, without any kind of special kind of license or prescription, because of the fact that they're um, not controlled substances. They're just a regular prescription from a doctor. You can get them, and that they may help. I mean, it's sort of like, why not? Especially because the side effect profiles tend to be pretty minimal. So, yeah, it's
Yeah,
it's exciting times.
it is. It is. I believe that any cancer diagnosis post COVID or recurrence post COVID is highly suspect. And I would like to touch on that briefly.
Well, I think that the safest posture is to assume that it's COVID related until proven otherwise. Because if it's COVID associated, which means it's happened, since you either had COVID or since you got the vaccine or both, really either one is considered what we call spikeopathy, which is potentially spikeopathy, which would be spike protein associated disease. And with the way we check that, I know we've talked about this before, but the way we check that is with the anti-spike protein antibody titers, which are a proxy for either the level of spike protein exposure or the spike protein mediated immune response. But either way, if you have an elevated anti-spike protein antibody titer, that absolutely, to me, would indicate that it's unlikely you're going to see as much benefit from conventional cancer therapy unless you are at the same time treating yourself for long COVID vaccinosis, vaccine injury. And so, I think that's something that's under recognized. The other thing that's really useful about that test is that if the levels, certain sort of thresholds we've noticed in our practice are associated with cancer. Now, does that mean all the people who have those thresholds or at those thresholds of anti-spike protein antibody response know that they have cancer? No. But does that mean that they don't? No. you know it's very, I think it's very likely that, and I think we've seen that some of those patients will actually turn out to have cancer they didn't know they had. So that can actually be an impetus to say, okay, let's go ahead and do further investigation. Let's do our cancer screen, which, as far as I know, is the most involved advanced cancer screen that as anybody's doing.
I just you just provided me a lab requisition for me to, the whole cancer panel.
Mhm.
And I'd be happy to report on the results, in another episode. I just want to
Sure.
be completely open and vulnerable, about, what's showing up for me. How many vials it was in? Like 21 vials, less than a blood donation.
Yeah, blood donation's 50.
Yeah.
So
But yeah, I look forward to having my labs complete and reporting on that. And it is one of the most, how do I say, state of the art, um,
state of the science.
state of the science, art and science.
This is a little bit of an inside joke because the term medicine comes from the Latin ars medicina, which means the art of healing. And so the irony, of course, being that modern medicine is sort of anything but healing or an art. So we sort of often trade back this whole idea of art versus science and the real definition of what it means to practice medicine. And how few doctors are still doing that, I would say.
Yeah.
Yeah.
Yeah. There's a flow that patients, when they become aware of our practice and aware of what we do, and not only what we do, but what we stand for, the practice of honest medicine, putting patients first and really honoring the individual with a deep dive into their genetics.
Well, and the end of chronic disease now. I mean, that's kind of the overarching
Yes,
what we stand for. And that's
absolutely.
something that I think is the end of, well, really not just chronic disease, but human disease, period. You know.
Absolutely. I mean, I wake up present to that almost every morning. Two couple of things. Um, present our overarching commitment as a team,
Mhm.
and also as your wife, um, not knowing you, you know what I mean?
Mhm.
Like we're on a fresh canvas for that day.
Yeah. And it takes something to listen to someone as nothing and possibility. So I appreciate that.
Or else every day would be like, why do you keep doing that? Why do you always do that? Oh my God. It's just
Not that that never happens
not that that ever happens,
for
but
both of us.
yeah,
So, that's but really I think having the commitment to
has us move through things very quickly.
yeah,
Whatever resentments and regrets and disagreements we have, we do what it takes to come back to love and affinity with each other so that we can be focused on the mission at large.
right.
Yeah.
And as those things come up, it shortens the time it takes us to be able to then say, okay, well, okay, but back to what am I committed to? Right.
Yeah. So
So
whenever there's like a group patient call, or whether we are on filming a podcast, whatever it is, that we were dealing with gets cleared, so that we can show up as a force. So I was just talking about the flow, the many ways that people could approach
our
our
practice.
practice.
Yeah.
So I'll give you an example. This gentleman, um, 65 years old, he started with a preventive group call. Well, we invite everybody onto these calls, whether you have cancer, whether you have long COVID, whether you just want prevention. And what he ended up doing was the spike protein test. What's the fancy SARS-CoV-2 antibody
Panel.
panel?
Yeah. And we're looking for the presence of the nucleocapsid as well as the titer of the anti-spike protein response.
Yeah.
So that tells us, A, have you ever had COVID? Or maybe especially in the last year, and then B, what's your level of the of immune response against the spike protein? And the reason why that's important is because it's the spike protein that is the sort of source of the cytotoxic effects of COVID. So
Mm.
COVID does its damage through its spike protein, and both directly, as in the spike protein itself is cytotoxic, but also indirectly in the sense that the spike protein is the way that the virus is able to get to bind to the ACE2 receptor, or actually with Omicron, you have direct viral entry through the cell membrane, but historically through the ACE2 receptor, and get into the cell to then hijack um, the ribosomal protein manufacturing to produce new virus. So
I'm flashbacking to when we met him, and when he was sharing his story, uh, he was crying. So that was a little stark, for me. It's very masculine man crying, because he felt duped. He felt gaslit into getting the vaccines, and I think he received 3, and
yeah,
it's by
a
the
lot of people do.
third, that we start seeing issues. But yeah, mm,
Well, some people have issues with the first dose, and your risk of having side effects goes up with each additional dose. So just because you didn't react to the first 3 doses doesn't mean you won't react to the fourth, is I guess what that means.
okay, yeah, and so he got his results back, by the way. Well,
Mhm.
you know,
Yeah, I know.
and it was off the charts.
Yeah. Anytime I see a result that's off the charts, my first question is, you know, let's make sure this person doesn't have cancer.
Yeah,
Period.
so he was like, boom, okay, what do I do next?
Yeah.
So that from attending that first call to getting the results, for his spike protein test, he has now registered into our wellness plan, which includes all of that comprehensive testing. I mean, it's a giant compared to, the the 5 labs that are
Hmm.
usually drawn?
Oh yeah, I mean, I was rattling off the CBC, CMP, lipid, TSH, vitamin D, and PSA if you're a man, because it's a pitiful level of analysis that they do.
I mean, it's what has the doctors
It's a
saying,
joke. It's
your
a total
labs are
joke.
normal.
Normal, like
Let's check them again in
there
3 months.
there are literally thousands of labs that can be tested on humans. You've tested 5, and you're telling people all your labs are normal, you know? Sorry, but if you haven't at least checked each body system, each pathology, whether it be cardiovascular, neurological, um, you know, and or neoplastic, which is cancer, if you've not tested the different ways in which the body can go off kilter, if you haven't tested the organ systems, then how can you possibly say that all your labs came back normal? All the labs you ran came back normal, but if that's like 5 labs, then sorry, that's just not even remotely enough to be able to say. And they'll say, but that's the standard of care, which is to say that's what I learned in school. It's like, okay, yeah, that's what I learned in school too. That doesn't mean that I had to stop learning the moment I graduated. So, lab diagnosis is something I'm very passionate about, obviously, and diagnostic medicine, I think, in general. And, I'll be honest, the naturopathic medical students that rotate with me have all said that they've learned more about lab diagnosis working with me than they have in school or from any other professor. And I think that that's really a testament to my passion for diagnostic medicine. My nickname in residency was Testarossa, and it wasn't because I drive fast. I like to run tests.
You do drive fast
It's
sometimes.
well, maybe occasionally if we're running late. But the point is, I like to run tests, but I also believe we should test, not guess. And I'd rather wait and make sure we have the correct diagnosis than spend a lot of the patient's money on treatment when we could be treating the wrong thing. So, and for the most part, we find that insurance coverage for lab work is pretty good. So thank you all for joining us on this episode of the Partovi Effect, Creating the Consensus. I am Dr. Ryan Partovi.
And I'm Mrs. Madi Partovi.
Thank you so much for joining us. Be well.